Hi, my name is Jessica Moore, and we're going to be talking about using the Wells criteria for identifying risk of pulmonary embolism, or DVT. A pulmonary embolism is a sudden blockage in a lung artery that is usually caused by a blood clot that travels to the lung from a vein in the leg, oftentimes referred to as a deep venous thrombosis. Pulmonary embolisms are a very serious condition that can cause low oxygen levels in your blood, stroke, pulmonary hypertension, or damaged organs in the body due to lack of oxygen. Pulmonary embolisms can even cause death if left untreated. According to the Centers for Disease Control, estimates range from 300,000 to 600,000 people a year affected by pulmonary embolism, and 60,000 to 100,000 die each year due to this complication. Pulmonary embolism is also the third leading cause of cardiovascular death in the United States. It is imperative that a pulmonary embolism be diagnosed as quickly as possible in order to initiate treatment. The Wells criteria is a system that was created by Dr. Anderson Wells to rate the risk of pulmonary embolisms, or DVT, thus avoiding costly workups and subjecting patients to unnecessary radiation of diagnostic imaging. It places patients into the corresponding risk category associated with their score. The Wells criterion places patients into categories such as low probability, moderate probability, and high probability. One study conducted by the Annals of Internal Medicine shows patients in the low probability category, followed over the course of 3 months, only 5 out of 849 developed pulmonary embolism, or DVT, in that follow-up period. This finding displays the accuracy of using this criteria. This is the Wells criteria as developed by Dr. Anderson Wells. You can find this at www.medicalgeek.com, or you can simply go to Google and type in Wells criteria calculator, and it will bring up your patient's risk score. So I found a helpful mnemonic for this criteria, and it is "Don't die, tell the team to calculate criteria." Don't stands for the DVT symptoms. Die is the diagnosis, most likely PE. Tell, tachycardia. The team, 3 days at least of immobilization. 2, thromboembolism. Calculate, coughing up blood. And criteria stands for cancer. So you add up the points, and as you can see on the bottom of the screen, it will tell you what your risk score is for your patient. If they're a low risk, it's less than 2 points. Moderate risk is 2 to 5 points, and a high risk is greater than 6 points. So now I'm going to show you how to perform the Wells criteria. Hi, Candy. It's nice to see you again. Have you recently experienced any paralysis or injuries to your legs?
Yes, I've recently broken my right leg.
Okay. And did you have to wear a cast?
Yes.
Okay. Were you recently bedridden for more than 3 days in the past month for any reason?
No, I
due
was
to that injury.
Around.
Okay. And I'm going to go ahead and look at your legs here and tell me if you have any tenderness in either one of your legs.
No.
Okay. So there's no tenderness. I'm noting that there is no edema and there's no discolorations of the legs. I'm going to go ahead and take your pulse here. Okay, and her pulse is 80 and it has a regular rhythm to it. Have you ever had a history or a diagnosis of a DVT or pulmonary embolism?
No.
Okay, and have you recently been coughing up any blood?
No.
Have you ever had a diagnosis of cancer?
No.
Okay, so with Candy's Wells criteria score, we have given her a score of 1, because she did break her leg and she did have a cast on it, but there were no other points awarded to her for any other part of the criterion. So she is actually in the low probability category of PE. So that's how to do the Wells criteria, and thanks for joining us.